Welcome back to Practical Parenting, the podcast that helps empower parents in the trenches, find joy in the process, and thrive through it all. I'm Krystina Wales, here with my co-host, Dr. Terry Nguyen, Chair of Pediatrics at GBMC Healthcare. Our kids are exposed to a lot of things, especially in the summertime when we're out and about more in the heat and different environments outdoors. It is normal for them to experience rashes, fevers, bumps, and bites, but how do we know when these are sort of par for the course or they require more serious attention? So we're going to break down some common ailments Dr. Nguyen and other pediatricians in her practice receive questions about, as well as how you can treat them at home and when you need to come in. So we'll start first with fever. I feel like that's a really popular one, especially parents with high anxiety. Hi, it's me. The kid gets a fever and you immediately freak out and think that it's, ED worthy, but it's not.
Perfect. Yes, it is. Worry not. Fever is just our body's way of saying, I have, there's invader here. And whether is it viral or bacterial, your body's great immune response is going to create a fever so it can literally kill the germs, okay, whether it's viral or bacterial. So you don't have to worry. For me, that your child can get a fever, that's a great thing. That means your immune response is working really well and as it should, okay? If you notice an invader, you want to be able to knock it off its feet. But the only problem is while it's knocking off the invaders, it's knocking off everybody else too. So your child gets really tired, they're not very engaged, and they are burning up. They feel really hot. So I understand why you're getting stressed and distressed. So number one, don't freak out. Take a breath and say, oh yeah, we heard this on this podcast before, or we've heard Dr. Terry's voice talking about this on call. And sure, take one fever so you can tell me, what the temperature is. But after that, please stop taking that temperature. The height of the temperature does not tell me how ill your child is. It really is how are they behaving. Now, this is for children 2 months and above, okay? It's a separate topic when your baby is between 0 and 2 months and has a fever. Children, babies who have 0 to 2 months who have a fever, meaning 100.4 or higher in the rectum or in your mouth, you do need to contact your pediatrician if your child is between 0 and 2 months. After 2 months, please, everyone, breathe. Say, you got it. My baby's above 2 months. I'm going to go on my maternal, paternal instinct that my child is eating and drinking. It's just they spike this fever and then they're miserable and they can't do anything. They're not doing the normal thing. But then I give them acetaminophen, which is Tylenol, or ibuprofen, which is Advil or Motrin. And about an hour later, they're like playful again. So that tells me, yay, they have something very manageable. I can stay calm and cool until the doctor's office is open. And honestly, so at what length of fever am I worried about? If you have a viral illness, the fever will last 3 to 5 days. But kind of my trigger is if it's 5 days and your child still has a fever, yes, please call us. Please come in and see us. But, if today is day 5 and there's a fever, please don't wait until tonight so that you're like, oh my God, she said 5 days. Yes, I've got to rush off to the emergency room. No, we're open all day. On the 5th day, if there's a fever when you wake up, sure, come see us, okay?
And that's a fever if they're otherwise acting normally. You would still, after 5 days, bring them in?
I would, because, even, if they're having a cough, right? This illness started, most of the illnesses are viral illnesses, honestly, right? They might have a cough or a runny nose, but in the summer, they may not have anything except for maybe a little rash. We'll be talking about that, right? And they're okay otherwise. So, sit tight on it. But if there's, and I'll bring that in later as well, as if there's a sore throat with a fever, yes, you should come in the next day and have your child tested for strep, pharyngitis, right? Fever with a sore throat for sure. And fever with certain rashes, you'll want to be evaluated. But honestly, for the majority of them, they can all wait the overnight period. And then it gets trickier if our doctor's office is closed on a Sunday. Do I wait out Sunday, and not go to an urgent care, or do I need to go to, the urgent care on Sunday? And we can talk about that as well. But fever is not to be feared, so fear not fever, okay? It's all about your child's behavior. If they're acting well in between the periods of fever, they're okay. Let it ride, because you will save yourself many doctor visits, okay, if you can ride it out for 3 to 5 days, because the majority of viral illnesses will have dissipated all on their own in that time period. And the other thing, okay, with the fevers is some parents get really worried about the height of the fever, and that does not tell you how sick your child is. If anything, a lot of the viral illnesses tend to run higher fevers, okay? So my advice is take one temperature, make sure you have the sheet from your pediatrician or family practitioner on, what dosing of acetaminophen or ibuprofen to treat your child with, and then give it to them. And then after that, please stop taking temperatures. Remember, temperatures don't tell us anything. And then you might say to me, oh, but I'm worried. What if they have a seizure? Well, guess what? If they were going to have one, they're going to have one. There's nothing you can do to actually stop that fever, stop that seizure, okay? You have febrile seizures because your brain is not regulated well, your hypothalamus, where your temperature is controlled. It's when you get a fever, it goes up really quickly. And that quick abruptness rise in it, that's where you get the seizure. And some children have a tendency for it and others not. So if your child has a tendency for it, there might have been a family history. Usually it shows up somewhere between 6 months of life to 6 years of life. It's still pretty rare, but it happens. And it's benign. It does not mean that they're going to have seizure disorder. A small percentage, less than 1% of those kids, convert to having seizure disorder later on, or epilepsy, okay? So, like I said, the height of the temperature is not telling.
Even when it gets up to I forget what that.
So,
But then your kid's probably not drinking, not eating, very lethargic.
Right. If it's 105, it's very rare, but still, believe it or not, I would say, okay, if they were acting well before they got to the 105, give them Tylenol or Motrin, sit on it for an hour and see where they are. Please don't take a temperature right after you give. This is very famous. Parents will take a temperature like 10 or 15 minutes after they've given the fever-reducing medication. And they'll call us and they'll go, oh, my God, the temperature even went up. I'm like, it was going up before you gave the medication, and the medication hasn't had time to absorb. Please remember, it takes 45 minutes to an hour for it to, really do its thing. So my thing is, take one temperature and you go, oh, yeah, 100.4 or higher, or 38 degrees Celsius, real temperature, real fever. Let's treat it. And then check in an hour later, don't leave your child alone per se or something like that, but don't get I've got to do something. Okay, it's been 15 minutes. Let's take a temperature. It's been another 15 minutes. Let's take a temperature. I've had parents give me blow by blow every 30 minutes. I'm like, we don't need that. How's your child? How's he or she doing? Are they eating or drinking in between? Even if they don't eat, remember when you're sick, do you want to eat? No. Do you think your child wants to eat when they're feeling really awful? Probably not. But please encourage them to drink, because they've got to pee at least 3 times a day, because I don't want them to get dehydrated, right? That and the fever-reducing medication, and really focus on their behavior. So that's the big thing about fever.
Awesome. I will say, we didn't discuss this prior, so I might be springing it on you, but, there's the head thermometers. There's the ones you put in your mouth. You can put it under your arm.
Yeah.
Is there best practice?
Yeah. Best practice would be, so for infants under 2, put that thermometer in their bottom, please. That's body temperature. And then the next thing after that would be an oral thermometer. Okay. The ear thermometer and the temporal thermometer, it can be plus minus 1, 2, 3 degrees. Okay. I've had people bring their children in because, oh my God, Johnny was 105. Come in. I'm like, yeah, it's 100.9. And it's okay. Really, my goal is to help you de-stress when your child has fevers and to keep you at home unless they have problems with breathing, okay? Unless you think they're dehydrated. But you really, after 2 years of age, you need, 24 to 48 hours of continuous vomiting and diarrhea to get dehydrated. And so you'll ask, like, how do I know they're dehydrated? Like, okay, their tongue, like, is a pasty potato. Their lips are dried and cracked.
You said it's peeing less than 3 times?
Peeing less than 3 times a day, okay? That means your child hasn't taken in enough fluids. And then ultimately, it's, again, how your child looks. When a child is dehydrated, they have no energy. They're like a wet rag on the floor. They don't move from their bed. I'm much more concerned about a child who's, okay, than a child who is like, woohoo, happy in between, and then spikes a 103, 104, and then takes fever-reducing medication and feels better. So problems breathing, dehydration, okay, those are the biggies. So what if you say, but my child has ear pain with their fever? Yeah, that's a good possibility. There's, an ear infection. But that can totally wait till morning. You don't need to, upend your life at 7, 8, 9, 10, or 11 at night, okay? You can wait
The ear infection's already upending your night, probably.
Yeah. But the best thing that you can do for the ear infection is pain control. So remember that acetaminophen or the ibuprofen, okay? I'm not rooting for either. Acetaminophen is every 4 hours. Ibuprofen is every 6 hours. So me personally, when my children were younger, that had a fever, I want to give ibuprofen right before bed because I'd like to eke in 6 hours before their fever comes raging again, okay? So that would be my only thing. But remember, you can only use ibuprofen starting at 6 months of age. So ibuprofen after 6 months of age, okay? So I think we started with the thermometer and we went on to some other.
No, it's all important information. So rashes too, you said come along with the fevers. Also summertime, you're outside more,
Yep.
maybe taking hikes if you're feeling adventurous, with the poisonous plants, bugs, all those types of things. So I guess maybe some common ways that you would get a rash and like maybe what the difference is between the different types.
I'd like to break rashes down to, are they allergic rashes or are they infectious rashes, right?
Okay.
So the allergic or rashes from chemical irritants, those are your bug bites, your poison ivy, poison oak exposures, okay? Or some kids are very sensitive. They have seasonal allergies, so they'll even react to pollens, okay, or grasses, okay? So, and then on the infection side, a lot of viruses that come with fever and rash, and there's viral as well as bacterial. So first, let's talk about the allergic type rashes. Most common is bug bites, mosquitoes. I'm going to remind everybody, in the first 5 years of life, when your child gets a mosquito bite, it's going to be a big welt, okay? And it's because your body is reacting to it, right? It's that great immune system that they have. And it is itchy, and it is like very itchy and red and big, and you're like, fear not. They are not bothered by it. They are scratching it. So what can you do? Keep the rash cool. Put a little hydrocortisone on it. So hydrocortisone ointment from over-the-counter. That will help relieve the itch. You can also give some Benadryl, which is also diphenhydramine, okay, and get the dosing from your doctor, okay, or on the bottle. And that will help with the itching. Okay, because if they scratch so much, they can get it infected if they break the skin barrier. And do you really need to know if it's a bug bite, what type of bug? Not necessarily. It's the reaction to the bug bite. But we will talk about, when is a bug bite a worrisome bug bite? Like, is it a tick bite and is it Lyme disease? Okay. But as far as bug bites that are itching and irritating, as well as poison ivy, poison oak, same treatment, Benadryl by mouth and topical hydrocortisone. Okay, so now let's go over to the possible infectious ones. The infectious ones, so strep can also present with a rash besides a fever and a sore throat. And sometimes with strep, you can get a headache or a tummy ache as well and have no other symptoms. So a strep rash is kind of all over the body, and it feels very rough. Okay. And you may or may not have a sore throat with it, but you might have a fever with it. Okay. So for that, I don't want you to wait on the fever for 3 to 5 days. I want you to call your doctor's office the next.
If you see the rash as well.
Yeah,
A
if you see
rough
the rash, yeah. But but do not panic. You have 10 days to treat strep throat. Yeah. So, like if you just saw it tonight and you're like, I don't know if I can wait till tomorrow. Yes, you absolutely can. Okay. Because strep will go away whether you treat it or not. The reason we treat strep pharyngitis, strep throat, is that we don't want it to go on to heart disease later on. And it's very rare. So you have 10 days to treat. You don't need to go to the emergency room or an urgent care. So that's the strep rash, right? And then there are other rashes that also come with sore throat that might throw you off thinking, oh, this might be strep. But again, you don't need to go tonight. Hand, foot, and mouth, which is caused by Coxsackie virus. And it can happen in children from, teeny tiny all the way through adulthood. And for us adults, I think it's even more painful than the kids.
I have heard anecdotally that
Yes.
is true, yes.
I've had it in one of my earlier years of practice. It feels like shards of glass in your throat. Yeah. So what will you see with hand, foot, and mouth disease? You might see some ulcers, some lesions in the mouth. You'll see a red throat in the back. But the difference between the strep versus the hand, foot, and mouth is that hand, foot, and mouth, it's blisters, all through the mouth, whereas with strep throat, it's a red throat. There's nothing, you might have a red roof of your mouth, but then there might be white patches on your tonsils. Here, there's no white patches. It's really like ulcers throughout the mouth. Ulcers and, it just doesn't look like it's pretty in
Be
there.
warned.
Yeah. And then there might be a rash. And why did they call it hand, foot, and mouth? Well, you may get rash on your palms and the soles of your feet, as well as on your hands and on your legs, okay? And I'm not expecting you to, know this, but and to differentiate, let's say, between strep versus hand, foot, and mouth. The bottom line is treat the fever that night, call the doctor in the morning, right? And the big thing you want to do is keep up with fluids because it is really painful, whether you have, your sore throat because of strep or because of hand, foot, and mouth. And the not so pretty thing is you can get hand, foot, and mouth over and over and over. And how do they transmit it? Saliva. So yeah, when you have one case in a daycare room, in a toddler daycare room, I can guarantee you it will probably spread to the majority of children. Because what do? They're licking their hands.
Well,
they're licking
pools I found is like if you go to a public pool and one of the kids has,
So it's, and it's the perfect age group. So yes, if you have a toddler or a preschooler and they have a fever and they have rash, good chance that it's probably hand, foot, and mouth disease, especially if it's in the summer. It is painful, so please treat your children with acetaminophen or ibuprofen because that'll ease the pain, okay? And you have to ease the pain in the throat as well if they have mouth lesions or else they're not going to drink for you. Popsicles are great when you want to encourage drinking. Popsicles, I'll do Italian ices. I'm not usually a sugar person, but I will be for this if you're not going to drink anything else. Anything icy cold is wonderful for the throat. Anything that's icy cold is wonderful for itching skin as well, okay? One last bug thing that I'll talk about really briefly is ticks, right? So parents often get really panicked when they pick a tick off their child. In the summer, we're living in the state of Maryland. We're highly, our deer are infested with ticks, okay? But not every tick bite ends up in Lyme disease. And the tick has to be on you for at least 24 to 48 hours to turn into a disease state. Why? The tick has to drink your blood, suck your blood, and then poop it back into your body, over a 24 to 48 hour period in order to transmit, the disease. So if you
New information for me.
Yeah. So if you just picked off the tick from your child this afternoon, please don't even just say, oh, I heard Dr. Terry talk about this. No worries. What's the best way to pick a tick out? Straight up. Okay. With tweezers, straight up.
I remember my sister having one in her ear when she was younger.
I've picked them off of boys' scrotums. So let's talk a little bit about how you should check your children every night. If they have dark hair, for sure, check the back of their head, the nape of their neck, the backs of their ears, okay? And check underarms, groin areas. And for boys, I kid you not, under the penis, under the scrotum, okay? Yes, because boys wear shorts, and these things curl up between your legs, right? So check every night during, if your child is playing in the woods, in the grass, yes.
Like even in your back, like we live in the city, like probably unlikely
really unlikely.
Yeah.
Yeah. But if you live in the suburbs of Baltimore County, very high likelihood. And if you see deer running through your neighborhood, like I do in Towson,
just do it.
You should pat down your child. Okay? So remember, picking a tick off today does not equal Lyme disease, right? And there's a very specific rash. It won't show up for, up to 14 days out. And it's a target lesion. It literally looks like a bullseye rash, okay? So please don't panic if you pick a tick off your child today. Chances are you're safe, and the tick has to be engorged. So you don't need any prophylaxis. But, okay, you're not sure how long ago it was. If it was under 72 hours, we can do prophylactic antibiotics for kids, okay? Other questions about Lyme disease?
So, but you wouldn't give the prophylaxis. In what case would you give it to them?
If we're unsure how long the tick has been on the child. Okay. And I know that you live in a Lyme-infested area. Maryland is Lyme-infested.
And you would do it as a precaution, I guess?
Yep. Mm-hmm. Okay. So, and there's age. There's, it's a one-time dose if you're 8 and above. It's trickier for the kids under 8 because they cannot take the antibiotic that we would give for prophylaxis. Okay. And I'm not going to go into more details about meds.
Yeah.
Your doc will know. But remember, you have up until 72 hours after the tick bite if you're worried to do that prophylaxis. But you want to meet criteria, and your doctor will know that. All I'm trying to do is save you the trip to the emergency department or the urgent care tonight because you picked a tick off of your child. And you know what? After you pick the tick off, tomorrow it might look like a bug bite, and that's okay. That's not a Lyme rash, okay? And if you were ever to do blood work, we would wait 4 to 6 weeks because it would take that long for you to have positive blood work for Lyme disease. Yeah. So if we just picked off a tick yesterday or last week and a parent wants blood tests, I'm like, it's meaningless at this point. And there's lots of false positives as well. Okay. Yeah.
So it sounds like, I don't know if you mentioned this with hand, foot, and mouth. Is there any treatment for that, or that's just a treatment at home?
It's comfort care.
Yeah.
The only times that we would have to see children is if they have so many lesions in their mouth and they're really not drinking and they're not peeing at least 3 times a day. Okay, bring them in and let the doctor assess if your child's dehydrated or not. If they really are, maybe we have to go to the emergency department to get intravenous IV fluids. I'm thinking back on my 24 years of practice. I can't recall that I've sent somebody for dehydration. There's other ways to get fluids in your child. But the key thing is to keep the pain-relieving medication going around the clock. Okay, so about an hour after you give the pain-relieving medication, which is the same as the fever-reducing medication, right? That's when you really push the fluids, right? Because, when the medication is wearing off, it really does hurt.
Yeah.
And, if you want to do a home remedy, here's one I can suggest. 1 part Pepto-Bismol or with 1 part Pepto-Bismol or 1 part Mylanta with 1 part Benadryl. So what does that mean? 1 teaspoon of each, mix it together, or 1 tablespoon of each, mix it together. Your child has to be old enough to swish it and spit it out because it'll coat the throat to give some comfort. But if you have an under 2-year-old, probably not because I don't know about swish and spitting.
Yeah.
So they might be overdoing the Benadryl and out they go. Maybe that's what you want. Yeah. And then if it gets worse, your doctor can prescribe something that has some lidocaine in it. But again, it's a swish and spit. So it has to be an older child.
So it sounds like for most of these, really a lot of comfort care at home
Yeah.
that you are able to do. You don't have to bring your child in. I know it's seemingly more comforting to you because then you have this expert opinion, but really it's just kind of like dragging your sick child out and like, subjecting them something that you really can't help
Right.
with at this juncture. So
Yeah.
it sounds like strep's really the only one that makes sense for you to come in because there is a treatment option for it. But for the most part, you mentioned the 2 medications for fever and pain frequently. So that seems like something you should probably readily have available.
Yeah.
But are there other?
Yes. So I have, a first aid kit that parents should have in their homes.
Great.
This is what you should have in your little SOS kit, your first aid kit. So acetaminophen, which is Tylenol or Motrin, relieves fever as well as pain. Ibuprofen, which is sold under the names of Motrin or Advil, again, relieves fever and pain. The one benefit is that it lasts for 6 to 8 hours, whereas Tylenol lasts for 4 to 6 hours. So if your child is 6 months and above, that's what I would give, ibuprofen before bed, okay? Benadryl, because that will help with the itching, okay?
Topical.
Topical and oral.
Okay.
Okay. And the generic of Benadryl is diphenhydramine. Again, it's diphenhydramine. It comes in liquid. It comes in pill form, so you're well covered. Okay. Hydrocortisone ointment. It's over the counter. It will help relieve itching. Okay. And a topical antibiotic, just in case you're like, I don't know, that bug bite, it's looking, a little uglier. Is it infected or not? Have some topical antibiotic, put it on, and you can see your doctor the next day. How do you know that a bug bite has turned into an infection? It's painful, okay? Before, the bug bite was just itchy. Now it's oozing, okay, like yellow crusted stuff, or it's painful. I'm going to say heat, but you can get a pretty hot, bug bite, a warm, okay, bug bite. But the hallmark of infection on the skin is going to be pain, and you're not going to miss it. You touch your child's like arm or hand, and they're like, they jerk and they kick you or hit you, and that's pain. Yeah.
Yeah.
So again, that toolkit that you want to have, really easy. Acetaminophen, which is Tylenol, ibuprofen, which is Advil or Motrin, oral Benadryl and topical Benadryl, topical hydrocortisone, and a topical antibiotic such as bacitracin or Neosporin. That's it. Please, no cough syrup, no guanfacine, nothing. Okay, no cough syrups or cold syrups. It's a multi-billion-dollar, trillion-dollar industry. I don't know. You don't need it. None of the physicians in my practice or the physicians that I know have that in their drug cabinet. So save yourself that $10 to $12.
Again, feels like most of this stuff is home care, but let's just reiterate all the things that, would bring you in, just,
Absolutely.
wrap it up, key takeaways. So dehydration, if your kid seems dehydrated, that's a big
right. And
red
dehydration is, they're like a wet rag on the couch, not moving all day. You're like tempting them with some of their favorite stuff and they still don't move. Less than 3 urinations a day. Or, the tongue looks like a parched potato. The lips are cracked and dry. But really, it's that lack of energy, like absolutely no energy, cannot pick their head off of the bed. Yeah, I'd be worried about dehydration there.
Fever's more than 5 days. And then if you are suspecting strep, that would be, within, did you say two days?
So I would go in the next time your doctor's office is open, but it's certainly not an emergency or urgent visit on a Sunday or at night when your physician's office is closed. Okay. And I felt like there was one more thing I wanted to say. The strep throat, you'd come in for difficulty breathing, okay?
That's the other one,
Yeah, that's really the biggie, guys. So dehydration, difficulty breathing, okay? Those I do want you to seek immediate care for, okay? It does make a difference. So, okay, so what's my definition of difficulty breathing? Panting. And it's not just the intermittent panting that babies do sometimes anyways. I'm talking continuous panting. Or, flaring your nostrils in and out, pulling in and out of your neck muscles by your clavicle. their belly's going in and out. And that's all they're doing is all of their energy is about breathing and they're sitting straight up. Yeah. Then, and if you want to count it out, if they're breathing faster than 60 times a minute, that's way too fast. Okay.
Okay.
I've never had a parent miss that their child is breathing too fast. Okay. But, a here and there, no, that doesn't deserve an emergency room visit at night either. Okay.
Awesome. Okay. Well, that was a lot of really good medical information. And yeah, I feel like we have a good toolkit for parents to have at the ready. And yeah, if you listen to this episode and you have any additional questions, specific questions, contact your pediatrician, obviously. But, any other things that you want to know about or learn more about, let us know. But otherwise, we'll see you next time.
Or you can write in the question for us, and we will answer it on our Microdose podcast.
Yes.
Okay.
Awesome.
Thanks.
Thank you.
Thank you.
Bye.
Bye.